The emergency room hummed with its familiar symphony of beeping monitors, hushed conversations, and the squeak of rubber soles on linoleum. Sarah had worked there for 5 years, long enough that the adrenaline rush had become something close to comforting. The ER's organized chaos was her element, a place where calm decisions saved lives. It was a typical Tuesday. The waiting room filled steadily, charts updated, and Sarah had just taken in a new patient. Under fluorescent lights, she paused at the nurse's station to update Maya, the CNA she'd worked with for years. "I need to check on Mr. XXX, Sarah said casually, using the patient's legal name. The name hung in the air. Leah, a new nurse just 4 days into orientation, snapped her head around, eyes wide with shock that quickly turned to fury. Her face flushed. "I can't believe you just called your patient that," she said, voice sharp and accusing. Sarah blinked, confused. She opened her mouth to respond, but Leah wasn't done. "What the hell is wrong with you? That's racist. You can't just say that about a patient." The outburst drew attention. A patient on a gurney turned his head. Doctors paused mid-sentence. A family stared. For a moment, the busy ER froze. "It's his legal name," Sarah said quietly, aware of the audience. "If you'll just—" "I don't care what excuse you have." Leah's voice rose. "People like you are the problem in healthcare. This is why minorities don't trust the system." Sarah's face burned. 5 years of hard-earned respect seemed to unravel as she stood there, publicly accused. Her stomach tightened. Maya stepped in, placing a hand on Leah's arm. "Hey, that's literally the name on his chart." Leah stopped, blinking in confusion. "What? That can't be right." Maya brought up the file. Leah leaned over the screen. Her rage deflated into horror. "Oh my God," she stammered. "I'm so sorry. I didn't realize. I assumed." But the damage was done. Whispers spread. Eyes lingered. Sarah felt exposed, her professionalism questioned by peers, patients, and visitors alike. The rest of her shift passed in a blur of awkward glances and brittle politeness. Each patient room brought the silent question. Had they overheard? When her shift ended, Sarah didn't stop by the break room. Instead, she walked straight to HR. Her report was clinical. Times, witnesses, what was said. No emotion, just facts. The HR manager listened, took notes, and asked questions. Within the hour, a decision was made. Leah, still within her 90-day probation, was let go. The hospital couldn't risk keeping someone who had shown such poor judgment, jumping to conclusions and creating a disruptive scene. News spread quickly. Opinions followed just as fast. "She was trying to be an ally," said one respiratory therapist. "Her heart was in the right place." "But she didn't even let Sarah explain," countered an ED doctor. "In medicine, you gather facts first. She didn't." For weeks, the fallout lingered. Some saw Sarah as the victim of performative outrage. Others whispered she'd overreacted. Conversations slowed when she entered a room. Lunch tables fell silent. At home, Sarah replayed it all. Could she have handled it differently, shown more grace? She'd survived worse violent patients, trauma, death. But this rattled her confidence in a way those things never had. It wasn't just being called a racist. It was being judged, condemned without evidence, forced to defend her innocence, watching righteousness override reason, seeing others swept up by the performance of virtue rather than its practice. Was she wrong to report what happened? Wrong to expect a colleague to check the facts before accusing her? Was professionalism no longer enough? The divide among staff offered no clear answers. And perhaps that was the most unsettling part, that even in a field built on observation and evidence, perception and politics could cloud the line between right and wrong. What would you have done? Was Sarah justified, or should she have shown more understanding? Does standing against perceived injustice excuse a failure to verify facts? Share your thoughts in the comments.